Good evening. First of all, I would like to thank the organizing committee for including me in this critically important conference on genetics and precision medicine in cardiology. I would especially like to thank Dr. Anastasakis for the excellent collaboration over the last 15 months, as well as for the profound professionalism and empathy he demonstrated under the difficult and unique demands of this program. I would also like to apologize for reading my presentation today. Under different circumstances, I would have delivered a speech without notes. However, one of the countless consequences of grief on the brain is cognitive decline, so my memory is not my ally anymore, and what needs to be heard today here cannot afford to be left out. My name is Χαρά Ντάτση, and I am a clinical psychologist, but today I am here mainly as a bereaved parent. The mother who said goodnight to her 17-year-old son one night and found him dead in his bed the next day. A young man who was full of respect and love for himself, for life and for people. Full of dreams about the summer and the life he had in front of him, waiting impatiently to live. On July 5th, 2024, I was forced to face the unthinkable reality that my son, who was perfectly healthy, both clinically and psychologically, died in his sleep. Yet, this unthinkable reality was the first of a series of other unthinkable realities and systemic failures which have brought me before you today. First and foremost is the reality of sudden youth death syndrome. My son, Kostis, was an athlete, so it was necessary for him to have the mandatory cardiac screening about 3 times per year since he was 7 years old. In the course of a decade, he underwent about 25 electrocardiograms, echocardiograms, blood tests. If we were certain of anything, that was the impeccable condition of his heart. No cardiologist ever mentioned sudden youth death syndrome as even a remote possibility. No one ever took a detailed family history, and no one ever alerted me so that I could investigate and educate myself. I do not know if it would have changed the outcome. What I do know, however, is that knowledge is power, and ignorance costs lives. Next, I face the reality of the healthcare system from the perspective of a parent left without answers. I received the forensic report exactly 6 months after my son's death. It did not provide any answer. A perfect body, a perfect heart, no trace of any substance use. The following day, the forensic pathologist called me on my mobile phone. I could hear the anxiety in his voice when he asked, "Do you have another child?" When I replied no, I felt his palpable relief. He was terrified of finding another sibling dead in their bed. He was the first person in Greece to mention the precision medicine program in cardiology run by the Onassis Hospital, which performs genetic screening. But that's all he knew. Navigating the system in Greece to find information felt like wandering in the dark. The program's website, iCardiacnet.gr, wasn't updated since 2021, so it wouldn't come up in any Google search. I believe it still doesn't. In sharp contrast, just 2 months after Kostis' death, I had easily connected with the SUDC Foundation, Sudden Unexplained Death in Childhood, in the United States. They provided me with everything: scientific guidelines on genetic protocols, research, free special ed psychological support, bereavement groups with parents sharing the exact same loss, and the ability to take Kostis' blood samples from the Greek morgue and make the genetic testing in New York. I'm mentioning that only to tell you that SUDC from across the globe gave me a safe space to exist and the possibility of solving the mystery of his death, which is extremely important to survive and function. because no one should walk this path alone. When I finally managed to connect with the Onassis Hospital, I was told that I had to personally transfer my son's blood sample from the morgue to the hospital. There is no coordination between the mortuary and the Onassis Hospital or any other hospital for that matter, resulting in the burden falling entirely on the parent. In torrential rain that day, inside a labyrinthine building with the brain barely functioning from grief, I faced an irritated employee smoking behind the desk, tossed a blank piece of paper at me. Write down that you received the blood, she said. I asked for a pen. She sighed with annoyance. And there, a mother whose son had just died 7 months ago had to compose herself a certificate of receipt. At the same time, I had to watch a young intern walking up and down the stairs, holding a vial. It was my child's blood. Finally, she gave me an envelope in which she had placed Kosti's blood. I drove to the Onassis Hospital with the yellow envelope on the passenger seat, terrified that the temperature or humidity would spoil the sample. The geneticist met me at the entrance of the hospital, opened the envelope right in front of bystanders, and left without giving me a single receipt of delivery. Since then, the procedures at the Onassis Hospital have been carried out for free with exceptional scientific integrity and care. Dr. Anastasakis always takes the time to explain everything to a parent. The program operates for free, as I say, with high quality standards, but it lacks the speed and, above all, the funding to meet the growing needs. It is an exceptional program that clinically and genetically screens 3,000 people and runs with a part-time secretary. There are parents in this room whose child has died and are waiting 10 months for a reply from the employee. I would dare to say that it runs only due to Dr. Anastasakis' commitment and immense sense of duty. The statistics of sudden youth death syndrome are overwhelming. According to the most recent survey by the Hellenic Society of Cardiology, which took place in 2019, I guess, about 300 people per year under the age of 40 are affected. These are deaths not from congenital heart diseases, but only from sudden youth death syndrome. And experts agree that the actual number is higher due to underdiagnosis. Another reality I was faced with is that parents are left completely alone against the system. There is no official service to guide us through the next steps. Speaking with dozens of affected families, almost none of them received the information I accidentally got from that one forensic pathologist. For this reason, we created the website www.natha.gr so that every parent can find the necessary process mapped out step by step in simple terms. Because a grieving parent cannot be expected to act as a detective. But we are just citizens, and we should not substitute for the state. It is of paramount importance, the state, to establish an institution or a structure that will guide the bereaved parents through this process and ensure a reliable connection between the mortuaries and the hospitals that are involved in the precision medicine program. In this way, the genetic research is promoted and families can take timely action to protect the rest of their members. Today, I do not just represent the families who have already suffered the loss. I represent the next 300 families who, by June 6, 2027, will be in my exact position. No one is immune to this. Minister Georgiadis, I know he left, but I will address him anyway. Do you think it won't happen to your children? Deputy Minister Agapidaki, do you think your family is safe? Dear attendees and participants of this conference, do you think you are immune? I know you think you are. In psychology, there is this term, optimism bias. We all believe nothing bad will happen to us. I know it, not because I'm a psychologist, but because that's what I believed too 23 months ago. 23 months ago, I was where you are. I was a proud mother of a healthy, happy teenager, a successful professional, and my family was a role model of calm and security. All this was lost overnight. The same thing has happened to many families before and after me. Without genetic screening, no family is safe. Your children, your nephews, your favorite godchildren, the children of your dearest friends may be carrying a ticking time bomb, and no one knows when it might explode. And believe me, you don't want to find yourself in my place. And this brings me to the most urgent request today, which is primarily directed to the Ministry of Health. Genetic screening for hereditary heart diseases must be integrated into and covered by AOP, the National Organization for Healthcare Service Provision for the general population. At this point, I would like to mention two major studies conducted in recent years. The first is the research by Dr. Julie Sherrill, University of Kentucky, who through population-based studies established that after a sudden death, up to 135 people, relatives, friends, colleagues, community, can be negatively affected in various ways. The second is a Swedish study of 2018 that utilized data from the National Archives of the Nordic countries. It found that mothers who lose a child, especially when the death is sudden, face a 31% higher mortality risk in the first 4 years after the loss of their child, whether from cardiovascular disease, cancer, or suicide. And that risk remains significantly elevated for several years afterwards. The conclusion is clear. We are no longer just talking about deaths from sudden death syndrome. We are talking about an entire micro-society put at risk beyond the genetically affected immediate family. I have experienced this firsthand when one of my son's friends committed suicide 2 months after Kosti's death. For all these reasons, the coverage of genetic screening by AOP is a duty of the state towards life itself. Modern science now provides us with the tools to prevent tragedy before it strikes a family and the community. Genetic identification offers a definitive diagnosis and allows targeted testing of relatives, identifying those who are at immediate risk before it's too late. By approving this coverage, you are not burdening the budget, you are investing in prevention. You are eradicating sudden youth death syndrome from the society of tomorrow. Informing the public and ensuring every citizen has access to genetic testing for hereditary heart diseases is one of the most profound acts of responsibility by the state and the Ministry of Health towards society. After all, it is a law and you have the power to change it. Thank you for your attention and for being here today. Allow me to dedicate this speech to the memory of my son, Kostis, and to Nicoleta, Stelio, Κωνσταντίνο, Δήμητρα, Βάσο, Τόνι, Αποστόλη, Γιώργο, Βασίλη, Ιωνα, Ναυσικά, Κώστα, Παναγιώτη, Marina, Ioanna, Mary, and all the children who froze in time.